Then you know what? Some people tell, Doctor, I got arthritis. I ask them, now we are in the COVID times. I know you are glued to the seat at home and you do the household work because your wife orders you to do it. Do you do any exercise? Oh, I will never do exercise. That is wrong. All arthritic patients should do exercises daily. That's very, very important. They should do range of motion exercises. They should do muscle building exercises. They should do breathing exercises. Pranayam is a very good exercise for arthritis. In fact, pranayam is a good exercise for the mind, breathing exercise for the mind. What you need to do is just to take inhale through one nostril, hold it and exhale through another nostril. If you do this sort of pranayam properly, then what will happen is adequate oxygenation of the lungs will take place. The mind will become very tranquil and you will be absolutely at peace. So exercises should be done by all arthritic patients and even people without arthritis. For this, you can consult a physiotherapist or a trainer and do it on very scientific grounds. When we ask patients to do arthritis to do exercise, I'll ask them after 4 weeks, do you do the exercise? No, sir. Did you meet the physiotherapist? Yes, sir. The physiotherapist cannot do the exercise on behalf of the patient. That is why most of the physiotherapists and all are very strong because they are only doing the exercise. So you must exercise your right to do the exercise daily. All arthritic patients, whatever exercises they are being asked to do, should they do it both in the morning as well as in the evening. If there is any pain or swelling in the joint, they can, what they do, they can give some ice fermentation. தமிழ்ல சொல்ல போனோம்னா யூஸ்வலா மத்தவாதுக்கு ஐஸ் வைப்போம். Arthritic patients அவாளுக்கே ஐஸ் வச்சுக்க வேண்டியிருக்கும். So what I'm just trying to tell you, ice fermentation is very, very good in the acute stage. When the joint is very warm and it becomes very stiff, then you can give hot water back fermentation. Now also you have commercially available heat pads also available in the Indian market. One of the best exercises for low back pain is to do swimming. Swimming is a very, very, very good exercise. Unfortunately, during COVID times, all the swimming pools were closed. Now slowly everything will get opened up. People who know swimming have to do swimming regularly. People who do not know swimming, you can go and learn swimming and start doing it. It's a very, very good exercise. How many types of arthritis are there? It is a myth saying there are only 4 types or 5 types. It is a total myth. The fact is there are nearly 180 types of arthritic diseases. That is why a person with joint pain and joint swelling has to consult only the rheumatologist who will know there are 180 types of arthritis. One small request to all of you ladies and gentlemen, please do not self-medicate yourself. You can read the internet. You may have a better knowledge than I accept it. Most of the patients come to my clinic, the hospital, outpatient clinic. They'll come and say, I got this problem, that problem. I've already done this test, so I got this disease. Then I ask them, what you want me to do? You prescribe these medicines. So actually what happened, I take my prescription pad, keep it like that, sign it and give it to them and say, whatever you want, you write. Nowadays what happens is, patients have become doctors' teachers. Let me tell you one thing. A patient can never become a doctor unless he goes to a medical college. A doctor can become a patient. Even doctors are there who have rheumatoid arthritis, ankylosing spondylitis or gout. For heaven's sake, please do not self-medicate yourself and don't go and read the internet unnecessarily and get confused. The nut, I always tell people, the net drives you nuts. You can read a little of it, but I see patients reading so much about it, they actually come and confuse me also at the age of 67 after 37 years of experience. Unnecessarily don't go into the internet and read about diseases which only cause confusion. Now what happens is, there is a myth going around the whole world, there is no cure for arthritis. Arthritis means that's all. End is over, joint will get crippled, I'll be totally bedridden, my life is gone, I'll not be able to go for work, then my family will desert me, etc. is there. Some of the arthritic diseases are curable. Majority are controllable. I can tell you in letters of gold you should write that all wonderful types of treatment which is available throughout the world is available in the Indian subcontinent. We should thank the government that all facilities for treating arthritis is available in India. We are at par with any other country in the world, or we may even be better, but in no way we are less. We have qualified rheumatologists in this place. All the medications are available here. So there is no question of you saying I got rheumatoid arthritis, that is the end of me. Though you can never say that is the end. You have to be positive in life. So if there is no cure for arthritis, then what do the rheumatologists do? It depends on what type of arthritis it is. If it is rheumatoid arthritis, they give them medications to decrease the pain and inflammation. And these drugs are called non-steroidal anti-inflammatory drugs. We rheumatologists may even give it for 3 months to 6 months. But let me tell you another important point. You do not go to the pharmacy and buy anti-inflammatory drugs like ibuprofen, diclofenac sodium and take it yourself. That's very dangerous. Non-steroidal anti-inflammatory drugs should never be taken when people have renal disease, when they have ulcer, when they have a history of a heart attack, when they have blood pressure. If a person with renal failure takes one tablet of an anti-inflammatory drug, there are chances that his name will be in the obituary in the newspaper the next day. If a person with active ulcer in the stomach takes one tablet of a painkiller, he can bleed to death. I'm not threatening you. I'm not getting you petrified about it. The truth is, please avoid self-medication with painkillers. That's very, very important. One tablet which you can take safely without asking the doctor is only paracetamol. Number 2, when people have arthritis, what they do, they go to the pharmacy. The pharmacist is a more qualified person than the doctor, and we take treatment from the pharmacist. In our country, the only problem is all medications are available across the counter. Abroad, you cannot get any other tablet other than paracetamol or a tablet Avil across the counter. All other tablets will require a prescription. Because medications are freely available across the counter, we misuse this opportunity, we get into self-medication, and unnecessarily we land with problems. There is one medication called steroid. This steroid was discovered by one Robert Hench 100 years ago. He sent me an email yesterday. He's crying in heaven. I think why the hell I found out the steroid, I do not know. It is highly abused drug in this world now. Available in the pharmacy, joint pain, it's available as dexamethasone, betamethasone, it is available as prednisolone, etc. They go and buy it in the pharmacy, they take it, or the doctor may prescribe for 4 weeks, they come after 4 years or 40 years. That time they'll be fat like a pumpkin, they'll have blood pressure, they'll have diabetes mellitus, they'll have cataract, the bones will be brittle. So it is an absolute myth to say that steroids cure the disease. Steroids have to be administered only by the doctor, and you have to take the tablet only under medical supervision, because steroids can cause dangerous problems like diabetes, blood pressure, and cataract. You can say, I have rheumatoid arthritis. Doctor, this drug has no drug is available to control your disease process. It is not like that. Wonderful medications are available to control the disease process in rheumatoid arthritis at present in India. We have a medicine called methotrexate, which was used earlier in cancer. It is also used in rheumatoid arthritis. It is used at a smaller dosage only. It is a darling drug of the rheumatologist because it's very useful in controlling the disease process in rheumatoid arthritis. And we rheumatologists think that rheumatoid arthritis is something like a methotrexate deficiency disease. Here is a guy with rheumatoid arthritis, put him on methotrexate. It's a wonderful drug and you have to take it only once a week and you should never take daily. That should be taken under doctor's supervision. Now, the hero of the day. If the villain of the day is COVID, the hero of the day for rheumatologist is a medicine called biologics. What are these biologics? There are dangerous fellows who causes inflammation in the joint. Just remember, they are called as cytokines, and these biologics will go and fight. They are the missiles to go and fight these dangerous fellows and control the disease process in ankylosing spondylitis, rheumatoid arthritis, psoriatic arthritis, etc. These wonderful medications are available in India and present. Number two, they are available at a cheaper, more economical rate than their foreign Western counterparts. Compared to what we have cost here and the compared to cost in the Western world, the cost here is only about 1/5 of what is there in the Western world. Our own Indian companies are making what is called as biosimilars, which are equally effective and equally safe, like what is called the original molecule, which is made abroad. So very, very important. If the doctor prescribes you a biologic, usually we educate the patient why, what should happen. Immediately they'll go and tell the other doctor and say, no, this is very dangerous drug, I will not take it at all. When the doctor tells something, please discuss with them. It is our moral obligation to you that we should discuss about the medicine. So you have painkillers called as non-steroidal anti-inflammatory drugs. Never self-medicate. They can cause stomach ulcer and bleeding. They can knock out the kidney. They're not good for a person with heart attack and blood pressure. Never self-medicate and kindly tell the doctor what you have for problems like diabetes, blood pressure, cardiac problem or anything like that. Steroids only to be given by the doctor, only be to be taken under medical supervision, and never to take the medicine continuously without seeing the doctor. Never go to the pharmacist and say, I got pain, and he'll give you a tablet of dexamethasone or betamethasone or prednisolone. Don't do that. Self-medication is dangerous, and equally so is going and buying medicines across the counter and taking it. We have wonderful medications available in India to control the disease process. One of them is methotrexate, the other one is biologic. They are all very, very safe. The only side effect of biologic is occasionally it can precipitate tuberculosis. It occurs in say less than 1% of patients in poor put on biologics. The doctor will educate you about it, but don't run away from the treatment. Now there is an important philosophical problem in patients with arthritis. They run away from the doctor. See, I'll tell you a very important philosophy in life. If you have a problem, don't run away from the problem. Run after the problem and solve it. That's very, very important. Don't be an escapist. If there is a problem in the office and your boss says solve this problem, you have to do it. What is the point in taking leave and sitting at home saying that I do not know how to solve this problem, I will not go to the office? That is not the attitude we should do. You should be brave. Similarly, you should be brave with respect to the treatment of rheumatoid arthritis. Be brave enough to take the treatment. Now, some people with arthritis, when I tell them, please don't smoke, they'll say, no, sir, it's very relaxing for me. Arthritic, nobody should smoke. In fact, there is a warning there, no, smoking is injurious to health, but nobody reads that, but still they continue to smoke. Arthritis is extremely bad. Arthritic patients should never smoke at all because an arthritis, the lung can get affected. Smoking damages the lung very, very badly. Arthritic patients should never smoke. And even healthy people should never smoke. The other things people tell me is, no, I got severe arthritic pain. I'm very depressed, I just want to have 2 pegs in the night and sleep. I just want to sleep off. My pain should be taken care of. Do not consume alcohol. The reason why I'm saying you do not consume alcohol is you are taking painkillers. Painkiller and alcohol is a dangerous combination to destroy the stomach. Some of the medications can cause liver problem. Alcohol will worsen the liver problem. So we should not take alcohol at all. arthritic patients should never take alcohol. There is a very important myth, it's a very crazy myth. Some patients will come and tell me, full moon and new moon, the arthritis becomes worse. Amavasya, Paurnami, the arthritis will become worse. It's all in the head. That moon is poor, innocent person. The moon already is begging light from the sun and shining in its glory. Why do you want to go and blame the moon and say that it is increasing the pain? The lunar cycle is increasing the pain. There's nothing there. Again, it is an mind. We look forward to new moon and full moon and immediately inside our arthritis will become worse. There is no influence of the moon on arthritis at all. Now, people who have arthritis, rheumatoid arthritis, they'll come and tell me, doctor, can I put air conditioner? The worst thing is they call me at 11:30 when I am sleeping in an air conditioned room, wake me up and ask me whether they can put the air conditioner. Already they are having the air conditioner on, whether they can continue to keep it running. There is no rule or any bad problem connected with what you call sleeping in an air conditioned room with arthritis. What you need is to wear a bed sheet, that's all. Cold weather will not precipitate arthritis. It may make your joints a little stiff. For that, if the weather is cold, I tell you one thing. Arthritis is seen in the Sahara Desert, very hot Sahara Desert, where the sun is very furious. Arthritis is also seen in Iceland and Greenland, where the weather is extremely cold. So cold and heat is not going to have any influence on arthritis, but only thing, the subjective sensation of pain will increase when the weather is cold. That time you can keep yourself warm by wearing warm clothing. You can wear gloves, you can wear woolen socks. And then what you could do is to use a room heater and keep yourself warm. So don't get frightened about cold weather and hot weather.